Hello, I'm pleased to participate in the 41-word seminar in COVID-19 7th part to talk about the following question. Is there a relationship between COVID-19 infection and the occurrence of anencephaly? An observation of the maternity of Mohammed VI University Hospital of Marrakech. We will adopt the following plan. After a quick introduction, showing the goal and material and method, then the result found, then after the discussion to conclude. Introduction. Anencephaly is a birth defect to a neural tube closure defect. It occurs when the skull, scalp, and brain do not develop properly during pregnancy. Portion of the fetal brain and skull are missing. The brain tissue that does form is usually exposed because there isn't enough skin and bone to cover it. Anencephaly is a later malformation. The prevalence at birth will be between 1 case per 5,000 and 1 case per 2,000. Subjective observation of the increase in the number of anencephalies in the Maternity Hospital of Marrakech University during the COVID-19 pandemic motivated us to consult the birth register. As you can see, and it has been questioned whether there will be a connection between the comparatively large proportion of fetuses with anencephaly and the COVID-19 pandemic. The objective of our work is to study the relationship between COVID-19 infection and the occurrence of anencephaly, since the literature is poor on this issue. Method and materials. This is a retrospective study between June the 1st, 2020 and May 31st, 2022. The study consisted in collecting the record of patients with the diagnosis of anencephaly during this period. Due to the fact that the file may be incomplete concerning the anamnesis of COVID-19 infection, the women concerned were recontacted and summoned in order to complete the anamnestic data. An exploitation sheet was established for this purpose, including identity, the traditional risk factor, the circumstance of discovery, the clinical and paraclinical information, the infectious history of the women and their spouse. The gestational age made it possible to know the date of conception as well as the target embryonic period, the closure of the neural tube which occur between day 18 and day 30 of embryonic life. Two fundamental data of our study. For each patient, we will look for a possible episode of COVID-19 infection and its distance in time from the target embryonic phase. For the entire sample, a comparison between the number of women in the target embryonic period and the epidemiological situation in Morocco. Concerning the integration criteria, we have any patients who gave birth during this period at the Maternity Hospital Mohammed VI in Marrakech with diagnosis of anencephaly without taking into account any associated malformation, the presence or not of cardiac activity and or the reason of consultation. Concerning exclusion criteria, any patient who gave birth during this period but whose presumed date of conception as well as the target embryonic phase will be prior to the appearance of the first case of COVID-19 in Morocco, namely March 22nd, 2020. Or any woman who has been diagnosed with anencephaly but has not given birth in our hospital. It should be noted that the Obstetrics Gynecology Department of Marrakech University Hospital receives all malformation because the only one in the region authorized to take care of them. Nevertheless, it happens that patients can give birth in other structures, lower level or in the liberal sector. The process made it possible to select 50 patients. However, only 47 were eligible for our study. Result. The frequency of delivery is heterogeneous, with an average of 2.8 delivery per month over the past 15 months. During the pandemic, we identified 47 parturients in whom anencephaly was diagnosed during an antenatal ultrasound in the Gynecology and Obstetrics Department of Marrakech, an average of 23.5 deliveries per year. The average maternal age at the time of diagnosis is 27 years, with a maximum of 44 and a minimum of 19. The average paternal age of anencephaly at the time of diagnosis is 37 years, with a maximum of 52 years and a minimum of 24 years. Concerning the profession, 91 are without profession, housewives. The remaining professions are agricultural sector in 2%, hotel industry in 2%, service sector in 4%. Concerning the profession of the spouses, 49 of the spouses were unemployed, 16% in the construction industry, 11% in the agricultural sector, 11% in the transport and logistics sector, and 9% in the liberal trade sector. Concerning the average household, 42% were living in rural area versus 58% in urban area. Only 7% of couples were consanguineous. 51% of the patients were multiparous versus 49% that were in their first pregnancy. The notion of taking fenugreek was found in 82% and the notion of taking unknown plants in 11%. Not all of the women knew about the harmful effects of the circumstances of discovery are dominated by emergency in 51%. The cause are treat of preterm labor 19%, premature rupture of membrane PROM 11%, treat of preterm labor associated with PROM 4%, patient in labor at term 11%, overterm in 4%, and thrombocytopenia at term in 2%. The remaining 49% of cases were diagnosed during routine prenatal ultrasound. 5 women in the study has reported the notion of fever. 3 of them has reported the notion of flu syndrome. 1 of them has reported the notion of confirmed contact case. None of the women reported any notion of cut or dyspnea. The women with a positive infectious anamnesis has all located this episode in the first trimester. None of the women in the sample received a diagnostic test to confirm the COVID-19 infection. None of the women has been vaccinated against the SARS Cov2 virus. 3 of the spouses in the sample has reported a notion of fever with chill and cut. The said episodes are concomitant with those of their wives. None of them has a diagnostic test of COVID-19. Only 2 of men in the study were vaccinated. The 2 men benefited from the vaccination respectively at 3 months and 2 months before the intercourse of fertilization. Counting the number of patients at target embryonic phase, day 18, day 30 of embryonic life, we note the individualization of 2 peaks, having their peaks respectively in January 2021 and July 2021. Each of them followed by a drop, then a slight elevation. It should be noted that many of anencephalic patients were in the period of neural tube closure at the time of the strong spread of the virus in the Moroccan population. The 2 peaks observed have 63%, including 34 during the first peak and 29 during the second peak. Another interesting fact is that the duration of the peak is consistent with the different wave of COVID-19 infection, with a parallel evolution between the 2 curves. Discussion. Regarding maternal age, our results are consistent with those of the literature. With regard to diabetes, we know that the glycemic figure is correlated with the risk of malformation. Multiparous women are more likely to contract COVID-19 because the virus circulates better in asymptomatically in the pediatric population. In our series, we find 51% of multiparity and 49% of primiparity. This table shows a comparison of the different results. Fenugreek is a non-real herbaceous plant of Mediterranean origin. Although widely used in phytotherapy, little scientific data attests to its therapeutic virtue. Scully reported 8 cases of malformation hydrocephalus spina coinciding with ingestion of fenugreek seed during pregnancy. In our sample, 82% consumed fenugreek against 11% in Radwan et al. Uh, there is a notion of taking plants of unknown origin in 11% of our sample. All these women were completely unaware of the risk incurred by consuming them during pregnancy. It is estimated that half of the birth defects are preventable if women of childbearing age eat enough amount of food rich with folic acid. The recommended dose is around 0.4 mg to 0.8 mg per day of folic acid. It should be noted that this prevention is not absolute, but leads to a real and significant reduction in the risk of this severe malformation, which closer neural tube defects. Meanwhile, uh, an Indian study described the first report of microarterial impacts of COVID-19 in women in periconceptional period, opening a new possible mechanism. None of the women in the sample studied received folic acid supplementation. Of our results agree with those of the literature. Average of gestational age of the sample studied is high compared to the other series, which support the hypothesis of delay in diagnosis and reduced access to health services during successive lockdown periods. The presence of associated malformation is not rare. Our results are consistent with those of the literature. The prevalence of anencephaly shows a great variation over time and space. Its balance from 1 per 1,000 in France to 12 per 10,000 in Iran, for example. In Morocco, the prevalence was about 10 per 10,000 birds each year before the pandemic. Uh, our sample is located approximately in 13 per 10,000. However, this is not the first time that bird prevalence have been recorded. Before pandemic, 2013 Indian study found a very high prevalence of 21 cases per 10,000 birds. After the lockdown period, there was a noticeable increase in open neural tube defects, which are thought to be a collateral effect of COVID-19 pandemic. This was observed in India and Iraq, without providing any strong evidence for the link between the pandemic and the occurrence of anencephaly. Some authors believe this to be a credible lead, but other authors suggest to conduct further investigation. High number has been observed almost everywhere before the pandemic, especially in Tigray in Ethiopia, and suggests that this is a global phenomenon. Preventive introduction of folic acid breaks the ground of the curve, but does not stop it. It reduces the occurrence of anencephaly by 20%. Transplacental transmission of COVID-19 is possible, but rare. Apart from rare reported case of fetal death in utero due to COVID-19, COVID-19 positive pregnant women are 3 times more likely to be hospitalized in intensive care units, 2.9 times more likely to undergo invasive ventilation, 1.9 times more likely to die. But the risk of malformation remains about the same. The disease has a similar spectrum of symptoms in pregnant and non-pregnant women, Although most symptoms are less common during pregnancy, they are still more likely to require admission in intensive care than non-pregnant women of childbearing age. An American meta-analysis has found that pregnant women with an active COVID-19 infection are more likely to have serious form of multiple disease and more particularly those with vascular components. The risk of fetal injury is correlated with the severity of maternal COVID-19 infection. Vaccination against the COVID-19 does not a priori present any danger to the maternal and or fetal prognosis. Vaccination should be encouraged, taking into account the benefits-risk ratio. The various vaccines in circulation do not show any notable difference either in terms of efficacy and term of complication. As the main result of our study, 93% of the sample did not have any infectious events related to COVID-19. The oxidative stress can possibly be caused by COVID-19 and could reduce sperm mobility and increase sperm DNA fragmentation. Spermogram carried out respectively between 56 and 109 days and 37, 52 days after an infection of COVID-19 do not find any significant abnormality. Overall, this preliminary data suggests that mild disease does not appear to have a negative effect of spermatogenesis. SARS Cov2 seems to have a tropism for human testicles, especially the Leydig ancestral cell. The literature is very poor regarding the relationship between COVID-19 infection and anencephaly. This is one of the main motivations for this study. This study proposed three main mechanisms. Firstly, a direct threat of SARS-CoV-2 virus due to the presence of ACE2 receptor in gamete, zygote, uterus, leading to a closure neural tube defects. Secondly, COVID-19 related maternal illness such as hyperthermia may induce the same malformation. Or thirdly, an user of antiviral drug to contain SARS-CoV-2 may induce the same malformation. However, all the study converges on the fact that the virus presents a negligible teratogenic risk. The co-expression of ACE2 gene is required to infection to occur. The vertical route of transmission, transplacental in utero, mother-newborn contact during childbirth, and breastfeeding is possible. ACE2 receptor required for a viral infection are expressed in the placenta, ovaries, uterus, and vagina, and may be involved in vertical transmission, mother-newborn contact during childbirth of breastfeeding is possible. And the risk of vertical transmission is very rare, but not zero. This does not exclude the hypothesis of contamination during embryonic life, since the trophoectoderm has ACE2 receptor necessary for the binding of the spike protein of SARS-CoV-2 virus. Their concentration vary between 3% and 69%, and a concentration of at least 1% is enough for a cell to be a target for the virus. The main result that emerged from this study is that the increase in the number of cases of COVID-19 goes in parallel with the number of anencephaly in the study. It should be noted that the Obstetrics Gynecology department of Marrakech received all malformation because the only one in the region authorized to take care of them. In view of all these results, two hypotheses emerge. The first is that a direct physiopathological mechanism favors the occurrence of anencephaly. The second is that the mechanism of association is indirect and rests on a social and economic basis. The pandemic having precipitated several households into precociousness, consequently leading to a reduction in their quality of life. These households can no longer bear the cost of medical care, no longer have access to information, and may even turn to riskier alternatives, in particular the traditional medicine. Unfortunately, the study comes up against several limitations. This is an observational and non-comparative study, so the relative risk cannot be determined. It is also subject to several BA, in particular memorization BA. Some women were cautioned about facts dating back to several months, and selection BA, some women having simply given birth in another hospital structure. However, the study has the merit of pointing the finger at an unexpected relationship and clearly show that there is a certain relationship between COVID-19 pandemic and the occurrence of anencephaly. The mechanism of this relationship is not completely elucidated, but could encourage more daring study. Since the publication of our prior study, numerous authors have noted that there was a significant rise in the incidence of anencephaly during the pandemic after the publication of our study, indicating that our observation is not unique. Without offering any strong scientific evidence like Morocco, this observation has been recorded in India and Iraq. Between authors who see it as a pathophysiological mechanism not yet discovered and others who call for caution, all agree on the need for more in-depth study. As a conclusion, our study has the merit of being a pioneer in examining the relationship between the COVID-19 pandemic and the occurrence of anencephaly. The results are in favor of the existence of this relationship without providing a clear answer in why and how. Whatever the answer, more focused study need to be conducted, including prospective randomized clinical trial. Thank you for watching.